Help! Someone help! Help me! Help! It burns! Help me! Help! The burns are not coming! Help! Help! Ow! 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 It burns! Ow!
Hi. My name's Taylor. Let's get you out of here. We want to get you out of here because of the fire.
Ow! Oh,
Here you go. All right, let's make sure this is covered with the burn sheet. Keep coming, keep coming. Go ahead, sit down. Perfect. We want to swing your legs up, okay?
ow, it burns. Ow.
All right, so we'll go ahead and just get him out of here. We're rapidly extricating because this is a critical patient with airway involvement burns. So as of right now, we are not collaring due to the rapid extrication.
Ow!
I'm gonna raise them up a little bit more.
Oh, it burns.
How fast were you going?
It's not even like 30, maybe like 27 or something. Ow!
What happened?
I was going and I just saw it blue from the minivan. It was
Alright, will you go ahead and help me with this? Ready? 1, 2, 3.
Ow!
Can we get a driver from you?
No.
Alright. Okay, thank you.
Okay. Are you from this car?
Yeah.
Are you okay?
Yeah.
All right. Let's get you in the vehicle and get you checked out.
Okay.
You might feel okay now, but let's get a good look at you, all right? What's your name?
Janet,
How old are you, Janet?
32.
All right. Do you have any big medical issues I should know about?
No.
All right. Let's get you inside and we'll take a look at you. It might be easier to go in the side door here.
Yeah, IV tray, drug box, all the things.
Okay.
Seatbelted if we're moving.
Ah! Ow!
Alright, so at this point,
Ow!
we'd go ahead, cut off all the clothes, make sure he didn't have any burns any other area. We'd go ahead and stop the burning process, so we can start doing that by flushing his face with saline.
Let's get a blanket on you, hon. Pretty bad day out there. So tell me again how old you are.
I'm 32.
All right. Do you have any drug allergies? No. Okay. Real quick, I want to start and assess you. And I'm trying to find out, a lot of times folks don't realize they have an injury. We try to check and make sure they don't. Any pain in your neck or head?
No.
How about there? Is your face okay? Open your mouth and look at me. Okay, good.
With him, we're gonna suspect airway burns and inclusion, so we're gonna look for soot in the nose and the back of the mouth. Can you open your mouth for me? Okay. So we'll just assume there's soot, since he can't really open his mouth all that much.
Intubation kit, IV, and fluids are ready.
Yep. In the event that we need to take more extreme measures, we're gonna go ahead and put him on high flow O2, regardless of what the SpO2 says.
Any pain in here, sir? Oh, it stings everywhere. Oh.
Let me go ahead and inflate this bag. That might help.
Alright. And can you open your mouth real wide for me? Perfect.
Okay, so you went ahead and you rinsed the face off, correct?
Yep, face has been rinsed.
Okay, got the high flow O2 on him. Go ahead and get the pulse ox on. Get IV access established. We can go ahead and start with 500 mLs. Go ahead and get this glove off you on your finger.
Oh. How's the pain doing? Oh, still stings. Can you tell me your full name? Samuel. What day of the week is it today? It's Thursday. Friday. What month? We're in January. What year? 2026. What city are we in? Jackson. Perfect.
Okay, perfect. So he's not altered. We'll
So
monitor the blood
cap refill.
pressure. If he goes hypotensive, we can consider push dose epi. Pain management, we can consider a ketamine drip. Based on his burns and location, that would be a contact med control, whether they would like us to go to the closest facility or rather a little bit farther for the burn center.
And we're going to take off all tight constricting stuff.
Can you go ahead and pull your arm for me?
I don't see any other wrist pains, any other shenanigans. What are we doing?
We're gonna take care of you, bud. I'm sorry this is happening to you today. Quick squeeze. I'm taking a blood pressure, okay? I'm looking for any burns on this
Good AC on
arm.
this side, no burns.
Okay. Go ahead and take that blood pressure every 5 minutes.
Sit back and relax for me, okay? Nice slow breath into your nose, out your mouth. Look nice and hard.
Turn the heat up. You want to make sure we keep him warm. Prevents hypothermia.
All right, your blood pressure is very good. All right. Any daily medications that you take?
No.
All right. Do you ever feel like you might have passed out after the accident, or do you think you've been awake the whole time?
I don't think so.
Okay. Are you staying warm enough?
Yeah.
All right. All right. Your initial vital signs look pretty good. You're the judge best of how you're doing. All right. I don't have X-ray vision, so I can't tell you if you have an injury that I can't see. I would recommend, because of the amount of impact that you're in, that you go to the hospital.
No, I don't want to.
All right. You are an adult.
How's your pain doing?
Oh, it still stings. It stays the same.
Is there any spot that hurts worse than others?
Just my face and my legs.
Your face and your legs?
Okay. Take a peek at his legs. No burns on the legs that we are seeing.
Ah.
What would you like for pain meds?
We can do a ketamine drip
Ketamine drip,
per our protocol.
0.2 milligrams per kilogram. How much do you weigh, sir?
234.
234.
105 kilos. Max dose of 25.
You got that IV?
Yep.
Okay, so we can give
Give
that.
16 on the left AC.
Okay, perfect. So we can give that through the IV over the course of 10 minutes. Continue to monitor, see if this helps with his pain, or if we need to contact med control for further direction, whether that's a repeat dose or maybe a different medication. Okay. All right, so we got the heat up, so we are monitoring him, making sure he doesn't go hypothermic. We're addressing the airway issues. as in reassessing lung sounds every 5 minutes, make sure his airway stays clear. High flow oxygen. Right now we're not visualizing any soot in the nose or the mouth. However, we are going to assume he has airway burns based on mechanism and based on the injuries that we are currently visualizing that.
Still don't hear any striding.
Seat collar, due to the traumatic nature head-on collision, we want to be mindful of any spinal injuries he might have. Reassessing his blood pressure every 5 minutes, making sure he's still maintaining adequate perfusion, and if that starts to drop, we won't be able to address that.
Yeah, he just burns so bad.
I know, I'm so sorry this is happening to you today.
I can't even feel the cold.
Do you have, will you start fluids, 500 bag of saline? We got a curb right here.
All right, team. We have a patient coming in. His name is Sam Delgado. He's 37 years old. He was involved in a head-on collision with an electric vehicle. There was heavy hydrogen fluoride poisoning at scene. He was rinsed on scene for 2 minutes, but we had to move quickly due to the scene safety and the fire conditions on scene. He has burns to the face, chest, upper arms, and thighs. There's soot in his sputum, and he has a hoarse voice. The initial vitals we got were blood pressure of 150 over 100, heart rate of 120, SpO2 of 100%, and he's currently on a non-rebreather. Okay, so let's take a minute to assign roles. Bethany and Chi-Chi, you're here from pharmacy. Can you verify and dispense any medications?
Yes, we will verify and dispense medications.
Thank you. Amanita, can you record for us? I'd like you to record all the times, events, review any results that come in, any monitor changes, and communicate those directly with the team.
Okay, I will record time and events, review results actually, and monitor changes and communicate directly with the physician and then the team.
Thank you. Sarah and Kaylee, I'd like you to complete a primary head-to-toe assessment. Obtain vital signs every 5 minutes. Administer warm lactated ringers to maintain a map of greater than 65 millimeters of mercury, and administer any medications.
Okay, we will make sure to obtain vital signs every 5 minutes. We will perform a primary head-to-toe assessment of the patient. We will administer medications, and we will start warmed lactated ringer IV fluids upon patient arrival to maintain a map of greater than 65.
Awesome, thank you. All right, Tyler and Sydney from respiratory, you're here. I'd like you to administer 100% oxygen via non-rebreather. I'd like you to verify the airway when the patient arrives. When you can, draw an ABG with co-oximetry and prepare to intubate if necessary.
We will administer 100% oxygen via non-rebreather. We will verify the airway upon patient arrival. As soon as we can, we'll draw blood gas with co-ox, and we are ready to intubate if necessary.
Great, thank you. Sarah, can you verify the IV lines that are placed by EMS? Place the patient on the monitor, draw a full rainbow of labs, and when we are ready, can you complete the 15-minute decontamination procedure? Also, I'd like you to draw an ionized calcium every 30 minutes.
Yes, I will verify IV lines placed by EMS, put the patient on a monitor, draw a full rainbow of labs,
draw a repeat ionized calcium level every 30 minutes, and just let me know when you want me to start the decontamination process.
Perfect, thank you. Okay, team, I think we can prepare for the patient arrival.
Okay. So this is Sam Delgado. He's coming from a 2-car MVA with the restrained driver of an electric vehicle. There was heavy hydrogen fluoride vapor on scene. We irrigated his wounds with saline. He sustained burns to his face, his chest, his upper arms, and his thighs. His vitals have been blood pressure 150 over 100. Heart rate was 120, and he's been 100% since being on the non-rebreather.
Thank you. On my count, whenever you guys are ready.
Ready?
1, 2, 3.
Great. Okay, team, can we place the patient on the monitor, get a set of vital signs, and can we get the patient's ID tag on his leg secondary to the burns?
Yes.
We're going to begin warmed lactated ringers at this time, now that lines have been verified as patent.
Can we boost the patient when we get a second?
Mm-hmm.
1, 2, 3. Thank you.
Hi, Mr. Delgado. My name is Kaylee. I'm going to be one of your nurses today. We're going to take great care of you while you're here. My first question for you is, on a scale of 0 to 10, how much pain are you in right now, with 10 being the worst?
10.
Okay, do we want to give any pain medication at this time?
Respiratory, how's his airway look? Let me listen to him real quick here.
I'm hearing stridor. We might lose the airway. We should probably look towards intubating him.
Okay, so let's hold off on pain medication right now because I think we're going to need to prepare to intubate. Mr. Delgado, hi, my name's Dr. Phil. I'm going to be taking care of you today. It looks like you're having a lot of trouble breathing. There looks to be a lot of burns in your airway, and I can see you're in a lot of pain. I think the best thing to do right now is to give you medications to make you sleepy and put you on the ventilator so that we can help you breathe. Is that okay with you? Okay.
Yes.
Great, thank you. Okay, team, let's prepare to intubate. Pharmacy, can you draw up 30 milligrams of etomidate and 100 milligrams of rocuronium?
Yes, preparing 30 milligrams of etomidate and 100 milligrams of rocuronium. Here's 30 milligrams of etomidate and 100 milligrams of rocuronium.
Thank you. Respiratory, whenever you're ready, I'm going to administer etomidate.
I'm ready when you are.
Okay. Administering 30 milligrams of etomidate at this time. Etomidate is in. We're going to verify patient sedation. Patient is not responding to pain.
No response to pain.
Okay, let's administer the rocuronium, please.
Administering 100 of rocuronium at this time. Rock is in.
Airway is clear.
Okay. Let's give the rocuronium a few seconds to work.
I'm going to lay the patient back.
When you're ready, you can go ahead and try to intubate. Right?
Give it a shot.
Nice job. Doing good. Your stats are still 100%.
Bilateral chest rise and color change. Bilateral breathstones, tube is in.
Great. Aminata, can you please call radiology for a stat portable chest x-ray to verify tube placement?
Okay, I'm calling radiology for stat checks X-ray to confirm 82 placement.
Great, thank you.
We have updated vital signs. Heart rate is 108. Blood pressure is 149/85 with a map of 106. Our respirations are 16. He has a temperature of 100.8.
Okay, team. Here's radiology's here, so once that tube is secure, please let us know and we'll clear the room so that they can take x-ray.
Got it. Airway is secure.
All right. Radiology, come in and shoot our x-ray, please.
Hi, X-ray. We had the armband on the legs because of burns.
Thank you. My name's Savannah and I have Grayson here with me. We're here to do a chest x-ray. Patient Sam Delgado, 2/22/1988.
You have a text We are ready for x-ray.
Okay. The tube appears to be in place on x-ray. Do you agree?
I agree.
All right. Tube's confirmed. Thank you, radiology.
Yep, thank you.
All right, pharmacy. Can you draw up 100 micrograms of fentanyl to help with sedation? And if we could start a fentanyl drip at 50 micrograms per minute.
Yes. Dispensing a fentanyl bag and 2.5% nebulized calcium gluconate.
Okay. The patient also has chemical burns secondary to hydrogen fluoride poisoning. Can we start some nebulized calcium gluconate via the endotracheal tube?
Dispensing the 2.5% nebulized calcium gluconate.
Thank you.
Now administering a 2.5% solution of nebulized calcium gluconate.
Great. I'm going to assess the patient's burns. Okay, so it appears that both upper arms are burned. That's 4.5% each. So that would be a total of 9%. It appears that both anterior thighs are burned. So that would also be 4.5% each, which is 9%. His entire face is burned, which would be 13.5%. And his trunk, approximately 18%. So by rule of nines, his total body surface area burned would be 36%. So we'd like to use the Parkland formula to fluid resuscitate the patient. The Parkland formula is 4 mLs times his weight in kilograms times the total body surface area burned. So if I calculate that out, I believe his weight is 106 kilograms, correct?
Correct. Yes.
Okay, so 4 times 106 times 50 comes out to 15,264 milliliters. That should be given over the first 24 hours. So we would give half of that in the first 8 hours, the other half in 16 hours. So if I do a quick calculation, that would be 954 cc's per hour. So if we could start that drip via IV, lactated ringers, please.
Beautiful. Using that Parkland formula, Dr. Phil, we will make sure that the patient is receiving warm lactated ringers at 954 mLs per hour. And I just wanted to verify with you that we're good to give the 100 mics bolus of fentanyl and start him on the 50 mics per hour drip.
Correct.
Beautiful.
Thank you.
Thanks, Dr. Phil.
I'm obtaining that ABG with co-oximetry now.
Awesome, thank you.
After the ABG is completed, do you want me to move on to the primary assessment?
Please.
Okay.
Thank you.
Okay, starting the primary assessment. Pupils are equal bilaterally and they both react to light. There is soot in the nares and in the mouth. There are no muffled cardiac sounds. We have an irregular rate with a regular rhythm. I am feeling the radial pulses. We have 2+ that are equal bilaterally on the upper extremities. Fetal pulses are 2+. They're equal bilaterally in the lower extremities.
Thank you, Sarah. So we now need to begin the decontamination process. The patient was burned with hydrogen fluoride. We need to, therefore, flush the areas with saline every 4-15 minutes. Then we will need to apply calcium gluconate gel, 2.5% to the affected areas. After that, we will complete our secondary assessment. So we can start our decontamination procedure now.
Preparing calcium gluconate gel now. Here's that calcium gluconate gel.
Okay, team, the decontamination process is complete. Can we please complete our secondary assessment and get a repeat set of vital signs?
Yes, we will get a repeat set of vital signs. Currently, his heart rate is 123. We have a blood pressure of 165/109 with a MAP of 128. We have a respiratory rate of 16. End tidal volume CO2 is 45. And we have a temperature of 100.8.
And I have the results for the ABG with the co-oximetry.
Great.
The patient has a pH of 7.48, a CO2 of 28, PaO2 is 80, and a bicarb of 23, and it's 15% on that co-ox.
Okay, so let's continue with 100% oxygen via the endotracheal tube.
Got it.
Thank you.
Dr. Phil, we're beginning to apply the calcium gluconate gel to all affected burn areas on the patient.
Okay.
All right. The monitor is actually showing a change in the cardiac rhythm. I am seeing frequent PVCs.
Okay, can we please obtain a 12 lead EKG? Respiratory, could you please take care of that for me? Thank you.
I have that EKG for you.
Thank you very much. Okay, so the EKG is showing a sinus rhythm with frequent PVCs and a prolonged QT.
So that call. Ionized calcium has resulted and it is 0.92.
Okay, so we need to start some IV calcium gluconate. Pharmacy, can you please dispense that?
Yes, preparing IV calcium gluconate, and additional doses may be needed.
And can we also continue with the gel application?
Yes.
Yes, absolutely.
At this time, I'm going to administer the calcium gluconate via IV. That is in.
Patient is becoming increasingly agitated. Current vital signs, his heart rate is 134. Blood pressure is 87/49 with a MAP of 62. Respiratory rate is 9. His end-tidal CO2 is increasing. It's now 56. And his temperature is still 100.8.
Okay, so we need to consider that the hydrogen fluoride is still being absorbed through the burn tissue. So what I'd like to do is start some Levophed at 10, please. Would also like to give a bolus dose of propofol. He's a little hypotensive, so let's give that at 50 milligrams and then start a propofol drip. And we need to consult trauma surgery immediately. These burns likely need excision.
Okay, I am getting the trauma surgery on the phone right now.
Dispensing Levophed and propofol.
Thank you very much.
She's on her way.
We're giving the patient a bolus of 100 mics of fentanyl from the pump. We're going to be starting Levophed and propofol at this time.
Okay, thank you. Hi, doctor.
Hello, Dr. Phil.
So we have Sam Delgado here. He's 37 years old. He was involved in an electrical vehicle head-on crash. He sustained severe burns at the scene. We're suspecting hydrogen fluoride poisoning. We started calcium gluconate through the IV. Obviously, you can see he's intubated. He's got some nebulized calcium gluconate, and we've been applying calcium gluconate gel. He's currently getting hypotensive, so we started Levophed. He was getting agitated on the vent, so we started propofol in addition to a fentanyl drip.
Thank you, Dr. Phil. It looks like Mr. Delago has some severe hydrogen fluoride burns, and they're pretty deep. I think that we need to take him to surgery as soon as possible. because we want to make sure that the fluoride doesn't reach his bloodstream. Can you please notify the operating room that we will be down for a wound, debridement, and excision with a partial to full thickness skin graft?
Okay, I am calling the OR team right now.
Thank you.
Team, could you please prepare the patient for transport? Respiratory, secure the airway, and nursing, let us know when we're ready to go.
Okay. Sounds good. We will get the patient placed on the Zoll monitor. Here's your cord for your leads. Thank you. Patient is on the Zoll. Everybody ready to move?
Break this up.
Yes. All right. Let's get into the OR.
Before you move, watch the back. And then ionized calcium improved, and it is 1.02. OR team is ready. Blood products and warming devices have been prepared. Thank you.
Okay, thank you.
You're welcome. Thank you.
All right, great job, team.
Thank you.
So let's do a bit of a debrief.
Yeah.
We'll huddle around over here. Okay, so if this was a real case, we would be wearing proper PPE. So we would have chemical-resistant gowns on, as well as chemical-resistant gloves. We'd be wearing N95 masks, full eye shields, and booties, which we don't have on right now. Sarah, what worked well today?
I think we worked great as a team. We flowed very nicely.
Great. Kaylee, what could we improve upon?
I think we could have been a little bit more direct and clear with our communication.
Gotcha. Thank you. Tyler, how do you feel everything went throughout the sim?
I felt it went pretty well. I was a little uneasy at first, as this is my first time dealing with an electric vehicle accident and dealing with the burns, but I thought it went well.
Great, thank you. And Chi-Chi, what's one clinical takeaway we could learn from this?
Yeah, I think we should implement a system-wide EV fire protocol, especially with electrical vehicles becoming more common in the future. So if this happens again, we will be prepared.
All right, great. Great job, everybody. Thank you very much.
Thank
you.